Hi, everyone. My name is Todd Streelman, and I'm the chairperson of the School of Biological Sciences. So, on behalf of our school and our faculty, I want to first wish you a happy Cinco de Mayo. And then, secondly, I want to welcome you to this fifth special town hall, this one titled COVID-19 Testing, Vaccination, and Mitigation. So, for those of you that have been with us through this, for about a year, we've held four, to this point, town halls exploring the rationale and justification for COVID-19 surveillance testing. We've updated surveillance testing data and promoted greater representation for surveillance testing on campus. We had a town hall to talk about case rises right before the holidays when we all traveled. And then today we're going to talk about this interaction between testing, the Institute's vaccination strategy, and mitigation of COVID-19. Our speakers are Joshua Weitz and Greg Gibson, professors and Patton chairs in the School of Biological Sciences, JulieAnne Williamson, who is Executive Director of Sustainability and Building Operations, as well as Team Lead for campus surveillance testing operations. Ben Holton, who is Senior Director of Georgia Tech Health Services. So as is typical, we'll have presentations by our experts and then question and answer. And if you have questions, please put them in the chat. We have a special guest and Georgia Tech student, Tanish Goel, who will moderate the Q&A. Tanish serves as the undergraduate Student Government Association cabinet representative of the international student body. As always, thanks to Jasmine Martin, assistant to the chair in biological sciences, and Jess Hunt Ralston, director of communications in the College of Sciences, for helping us put this together, publicize it, and disseminate it. And finally, I want to offer my congratulations to all students who are in the audience graduating, and or those students who are finishing their semester this week. So with that, I'll turn it over to the team. Please, guys, go ahead.
Thank you so much, Todd, for the introduction and for welcoming folks back again today. I'm Joshua Weitz, professor in the School of Biological Sciences, and I hopefully will get things going here, and someone will let me know that you can see my slides.
We can see them.
Wonderful. So as Todd said, this will be a team presentation today covering a number of items spanning testing, vaccination, and mitigation. And I will try to begin by giving some context of where things stand right now. And in doing so, I wanted to share a piece of art that is the result of collaborative work between a scientist in my group, Stephen Beckett, and an artist, an undergraduate student here at Georgia Tech, Mary Wang. And this stems from work we've been doing and pursuing since early 2020 as part of assessing the risk that there may be one and more individuals who may be infected in groups of different sizes. And we did that work really at a national scale, updating it daily at county levels. And you can see an example of the map in the background. But the reason we've been doing that, and the reasons I think that all of us have been working so hard collectively with other faculty, staff, and students, is precisely because of the images in the foreground, which are trying to keep communities safe, trying to get back to normal, trying to protect individuals from infection and severe cases that have obviously happened at large scale throughout the United States. And just to provide some context of the last time we got together, which was mid to late November, and we did so precisely because there was concern of rapid case rise, as you can see here, most intensively in the Midwest, but of course that then propagated throughout the United States. And we tried very hard to reinforce testing near the end of the term to make sure that as seldomly as possible, individuals who may be infected then returned home to communities, including communities where vulnerable older individuals may have been infected. Right now, we're in a different context. The total number of cases compared to where things were a few months ago, 6 months ago or so, is far better. And in many ways, although there's still persistent infections, the overall outlook is also looking better than it was in late November. That is true not only at a national level, but also at a Georgia level. As you can see from a peak near the new year, going through the holidays, we've come down off that peak, and although there are still persistent infections and COVID is still transmitting in the community, what you can see is we're at a much lower place than we were then in the fall or even in the summer peaks, even accounting for differences in testing capacity. One of the challenges, of course, is that it's often been hard from the outset to control SARS-CoV-2 precisely because many individuals get these asymptomatic cases. And I think that's illustrated very succinctly by the CDC, who have made an ongoing effort to try to estimate the total disease burden. And what you can see here is that they've estimated there are over 110 million total infections, despite the fact that through March 2021, only about 30 million cases were reported, which implies that really only about 1 in 4 COVID infections were documented, reported, 3 out of 4 not being reported or documented. And the takeaway there is really because of insufficient testing and these difficult to track asymptomatic cases, that means the majority of cases have not been documented. And this also, if we go back in time, was one of the central rationales for instituting large-scale testing. We expected, particularly given the age group of individuals in the campus community, that many infections would be mild or asymptomatic. The danger, of course, is that they then occasionally lead to infections with older individuals or vulnerable individuals, or just by chance where you have a severe infection. And so this is precisely why I think it's important to thank the surveillance team. This has been going on now since summer of 2020. It depends truly on a team of dozens of individuals. We've highlighted some of them in the past. JulieAnne will be speaking today. And I just want to again thank them collectively, although one of this group really on the analytics side, there were so many people in the lab, PCR lab, on the logistics site and testing sites. And earlier this year, they were rewarded with this and recognized with this Giant Leap Award for developing and sustaining this testing site operations program. So thank you to all those who've been involved in making this possible. And again, the point of this was to try to identify those asymptomatic cases before one case became many. In terms of benchmarks, there have been over 320,000 surveillance tests completed since the start and launch of this program, and you can see it over fall and spring with some level of testing taking place even in the intersemester period. And typically this was during the week, about 1,700 to 2,200 a day, sustained over the fall and spring, and as you recall, with a large push before the holidays to keep testing. And even at the beginning of this term, there was another boost in testing. This was, of course, not the only part of the mitigation program. From the testing side, it was supplemented by symptomatic testing and bulk kits, contact tracing and support, mask wearing, as we all know, as well as distancing and online teaching. And now, of course, this new weapon in our arsenal, which are vaccinations. So this has been a coordinated response to reduce ongoing transmission risk as far as is possible on this campus. And with this next stage, I want to turn it over to my colleague, Greg Gibson, to talk a little bit about what we've learned. So Greg, you want to take it away?
Thank you very much, Joshua. Thank you, Todd, and welcome everybody. So I'm just going to start with these two plots here, which are the positivity rate in the surveillance program in the fall semester on top and the spring semester below. And what you basically see there is that on 3 occasions, we've been able to mitigate and prevent a large outbreak. So as you recall, back in late August, there was a big spike up to 4% positivity in our testing program, and then that came down dramatically. We had almost no cases on campus through much of September. And then after a lot of people traveled at the end of October for Thanksgiving, it spiked back up, and then it was down again a few weeks later to close to 0. And then when people came back in January, things spiked again. You'll see there's a slight difference in the scale of those two plots, but it gradually came down over the month of January, and we've actually hovered around about 0.2, 0.3% daily positivity throughout the semester. Interestingly enough, if you look closely, you'll see that there are little spikes on a regular interval in both plots, actually. And I don't know why, but this semester those spikes are on a Tuesday and Wednesday, implying virus picked up on Thursday, Friday parties, whereas the previous semester they were on a Friday, implying maybe they were picked up earlier in the week. I don't know why the difference, but it's interesting that there are those little spikes there that fade during the week. But overall we've been at about 0.3%. So here's what I take away from those plots. So as I said, on 3 occasions, it looks like the surveillance program, along with social distancing and masks, prevented an outbreak. Cumulatively, we estimate that in the fall, probably around about 12% of the campus community was infected at some point, in line with the numbers that Joshua just showed you nationwide. But we think that was half of that, if not less, this semester, that at most about 5% of the campus community have been positive in this program. And most of those cases, don't forget, are identified by asymptomatic surveillance, and we believe that helped to keep things low. There is a difference in that we knew that a lot of the seating was happening in residence halls and Greek houses in the fall, but as we looked at the data in the spring, it seemed much more likely that there was this constant infusion of new cases from off campus. There was no house that really spiked tremendously, at least not for a long term, although there were some localized cases. But we had a lot more diffuse events throughout the spring, and that's probably more like we should expect going forward. I really want to thank the student body in particular, and the staff and faculty as well. I mean, it's just tremendous to go to these testing sites and just see how comfortable everybody is with the process. And the staff at those sites, JulieAnne and her team have done a fabulous job. It's really warming. So the upshot of that is that we probably have fewer than 10 cases currently on campus. And I think that's probably going to be the new steady state. But it won't be the new steady state if we get complacent. Okay, so we need to keep at this point. And that means, at least for the time being, we need to keep up distancing, mask wearing, and just behaving sensibly. But I would say, and I think the messaging is starting to change. Just today, we saw that the 50% research space is being relaxed in the next week. So, you know, grad students and researchers, come back in. Some of us have been here for a long time, and it's pretty safe if you're sensible and follow the guidelines. So we want a really active campus heading into the summer and the fall. Next, please. Okay, so around about starting in March, Anton Brixton and his team, which included Katie Ferguson in the lab and Rava Rishishwar in a consultant capacity, they began sequencing the viruses. So this is just a method we can use. It's the most accurate method to find out which variants are on campus. And to date, we've been able to sequence 149 samples, 70 of which, it turns out, what you may have heard of is the B1.1.7 UK variant of concern. So it spreads more rapidly. I think the evidence is ambiguous as to whether or not it has worse outcomes. But you see on the right there 2 plots that Josh was added showing in brown the proportion of the strains that are that variant in both the USA and the United Kingdom rapidly increasing. And that was the case in campus as well. So we had 1 out of 30 samples the last week of February with that variant. By mid-March, it was a half, and the last set that were tested from early April, 80% of those samples are that variant of concern. So it just shows how quickly one virulent strain can spread in a campus community. Luckily, it's not the South African variant, or particularly likely not the Indian variant, but there are others coming, and it just shows that we've got to keep our eyes out. We have seen a few other variants, but they haven't taken off yet. So it's 1.1.7 that we're seeing a lot of on campus. So what can we expect for the summer and fall? So JulieAnne will give you more details on how the surveillance program will continue, certainly through the summer, and we think in the fall probably at a reduced level. Our colleagues over at Emory are planning on ramping up, actually, but we hope that that's not necessary. And what we're going to do is focus on sentinel surveillance much more so than using this as a primary form of mitigation, which we don't think will be necessary. However, there is still definitely going to be some seeding from off campus, okay, because the experts are now doubting that we'll get to herd immunity across the United States as a whole. So there will still, so long as there are unvaccinated people, there will be viruses spreading. And that means that there's a chance of outbreaks happening. But so long as 80% of us are vaccinated on campus, then the opportunity for the transmission of the virus is greatly reduced, and we just don't see many pathways by which it'll get more than 0.5% or 1%. So that's good news, but it'll always be there. Now, the best way to protect yourself is to vaccinate and use the common sense that everybody's been showing for the last 3 or 4 months. We can expect a low incidence, as I said, for the rest of the year, but it truly does depend on vaccination rates. And although we're going to slowly relax masking regulations, we being the CDC and society as a whole, there's not going to be a mandate for vaccination. Josh will address that. But prudence says that if you're indoors, probably for now, keep your mask on, certainly also in social gatherings. Okay. And what we're worried about is a new virulent or highly pathogenic variant that could escape the vaccination. Now, there's no evidence, no strong evidence, certainly not for the ones we have on campus now, but we just need to be cognizant of the possibilities. Okay. So there's lots of reasons to return to campus now and get a vibrant community back working now rather than later. Regarding vaccination, it turns out, so some students in my class this semester, Genes, Health and Society, Madeline Siegelinger put together this Wix site here of a survey they did through Reddit, where they had about 400 or 500 students surveyed, and about 80% said they're willing to get vaccinated at the beginning, definitely willing to get vaccinated in January. It turns out when they resurveyed in late March, early April, that 90% of the respondents had been vaccinated. So that's very encouraging news. We don't expect everybody's going to get vaccinated, but the more people realize and the more help you can give people in sort of overcoming hesitancy, not lecturing people, just giving information, the better. And if you go to that survey site, there's a lot of interesting data. And this month on my own personal blog, Genome State, I've given links to the various different items that the whole class put together that has a lot of interesting things that are interesting to students on Georgia Tech campus in particular. Next slide. And so with that, I'll hand it over to Dr. Ben Holton to talk more specifically about the vaccination program on campus.
Good afternoon, everyone, and thank you for the opportunity to be here. And thank you, Joshua and Greg, for the points you've made so far and the emphasis on vaccine that you've already articulated. So I did want to talk a little bit about the vaccine program that we've had here at Georgia Tech. So hopefully you know that we are giving vaccines here at Georgia Tech. In the exhibition hall, the vaccine clinic is open 9 to 4 each day. You can schedule an appointment for a vaccine through MyTest, which is the same program that you use to register for a surveillance test. So to date, as of end of day yesterday, here at Georgia Tech, we have given 29,734 doses of vaccine. We had 300 people scheduled for today, so we should be close to crossing the 30,000 mark as of the end of the day today. Those 29,000 doses, almost 30,000 doses, have gone to 16,414 different individuals. And of those, 13,320 have gotten both doses here at Georgia Tech. So all of these numbers reflect the vaccine doses that we've given here at Georgia Tech. It does not reflect people who have been vaccinated off campus. I think this is amazing, and Georgia Tech is setting the example for the rest of USG in terms of the administration of vaccines. I am absolutely delighted with how the community has embraced vaccines, and particularly on the part of our students, how well they have stepped up to the plate and gotten vaccinated. Based on the vaccines that we have given at Georgia Tech, what we know is that 40% of faculty have been vaccinated at least one dose here at Georgia Tech, and 44% of staff have gotten vaccinated here at Georgia Tech. We know that those are low estimates of the percent of our faculty and staff who have been vaccinated. A significant number have gone off campus to get vaccinated. We have sent out communication asking individuals who have been vaccinated off-site to upload that information to the STAMPS patient portal so that we have a record of that. We've had more than 1,500 people upload their information, and I would encourage you to do the same if you've gotten vaccinated off-site. In terms of the students on the Atlanta campus, 54% have been vaccinated here at Georgia Tech. And again, that's a low estimate, but it's still an excellent indicator of how well the community is doing in terms of getting vaccinated. And I hope that Greg's class, the survey, that 90% have been vaccinated. I think that is a true reflection of what the true percentage is. I can tell you that at the end of the day, if we have leftover doses, it became more and more difficult to find people to vaccinate with those leftover doses when we wandered around asking for volunteers, because everybody said that they'd already been vaccinated. So that was an encouraging sign that we were being effective with our outreach to the community. And then, I think the most telling indicator of how well we have succeeded in terms of our vaccination program is if you look at our cases on campus, and they have nosedived. We have not had a positive surveillance test reported to Stamps from the surveillance lab since Monday of last week. We've gone a whole week without a positive surveillance test. That has not happened since the program started in August. And we have also not had a positive case at Stamps in over a week. And I think that is a reflection. We're seeing the fruit of our vaccination effort with the significant decline in the cases that we're seeing, both through surveillance testing and here at Stamps Health Service. And our 7-day rolling average for cases now is less than half a person a day. So I think that's a tremendous testament to how well Georgia Tech, the Georgia Tech community has embraced vaccinations. We will continue with our 5-day-a-week vaccination clinic through the month of May in the exhibition hall. So through May 28th, which is the last Friday in May, we will continue giving vaccinations 5 days a week. We're going to change the hours a little bit. We'll still start at 9 o'clock. We'll be ending at 3:30, and we're going to take a 30-minute lunch break. But we will still have adequate vaccination appointments to vaccinate anyone who wants to be vaccinated during this time. Starting in June, we are going to reduce the frequency of vaccine clinic, but we will continue to have vaccine clinics through June and July. We'll go to 1 day a week. It'll be on Tuesdays starting in June. I think we're going to continue doing that in the exhibition hall. So the location will be the same, and we'll continue to use the MyTest platform for scheduling an appointment for vaccine. So I encourage you, if you've not been vaccinated yet, to seek out an opportunity to get that vaccine. And I did want to take a moment to just appeal to those who may have some hesitancy about getting vaccine. As the vaccine rollout has taken place, we've gotten more and more data about the safety of the vaccines that we're using. We have not had any serious immediate allergic reactions in our vaccine clinic. So in 30,000 doses, essentially, we've not had anyone who required administration of epinephrine. We've not had to call EMS for any in our vaccine clinic. So our own experience has been that it's a safe vaccine. I think we're seeing in real time the effectiveness of the vaccine. There's a lot of misinformation out there about the vaccines. If you have questions, I would encourage you to seek out information from a reliable source, and you're welcome to contact me if you have questions that you'd like to discuss about vaccines, about their safety, about their effectiveness. We want people to get vaccinated unless they have a true contraindication to getting vaccines. And that's going to be our path forward to having a safe return of students and faculty and staff in the fall. Georgia Tech we have been the leaders in our response to COVID-19 in the 2021 academic year. And I would love to see us be the leaders in returning to normal operations as much as possible in the 21-22 academic year. Key to that is vaccination. And that's really all I have.
All right, so this is JulieAnne Williamson. I'll jump in on the testing. First off, I appreciate the opportunity to be here with you all, and just want to echo the thanks. This has been a community lift. We have so many partnerships with Dr. Holton, Greg, Joshua, Anton, Mike Shannon, and their teams, particularly on the science and the lab side, that made all this possible. But if our students, faculty, and staff weren't choosing to have safe behaviors and test and mask and distance, we would not be here. So thanks to everyone for doing your part. We just want to show our plans for summer. We are working with housing and summer programs and the leadership across campus to understand the best we can the occupancy through summer. So what you'll see is starting after commencement on Monday, May 10th, reduced operations. This is going to be similar to our approach to the winter holiday break, but we will be keeping 2 key sites open 5 days a week, and that's the library, the Price Gilbert site, and the 760 Spring Street in Tech Square directly across from the CODA building. We'll have a mobile team that continues the support for our research and graduate student sites, as well as West Campus residential areas. As residential volume goes down on campus through the summer, we want to continue that support, particularly for the research and graduate student populations that will be stable or increasing. And we have some flexibility to be able to pivot as needed. If we could jump to the next slide, it just shows a map with a visual. Thank you so much, Joshua. The blue and orange sites are the library and 760 Spring Street. So those are open 5 days a week. The mobile team will tackle the purple sites that you see, West Campus Residential Housing, IBB, Love, and 10th and Home residential halls. So you'll see a couple of black dots. We have some sites that we can spin online if we need to through the summer if we see volume surging. And we also have the opportunity to potentially address any research increases that aren't covered. We are taking steps with commencement this weekend to continue our testing at full scale until dropping back to these operations and on Monday of next week. And we'll continue to offer travel testing for Saturday, this Saturday again, for anyone traveling out of town as they prepare to leave campus. We'll continue for our employees and students who might be traveling over the summer, employees on business-related travel, students on any travel, to offer vault testing at both the library and 760 Spring Street sites, Mondays through Friday, 10 a.m. to 3 p.m. So thanks again, and that's all I had. Back to you, Josh and Greg.
Thank you, Greg. And I'll now try to wrap up the presentation part of this town hall, looking slightly ahead again to fall 2021. And just to reiterate what I think Greg and Ben have already emphasized, which is just the impacts that vaccinations are already having. And to do so, I just want to share 2 contrasting pieces of data, which is the rate at the country scale, obviously very different size countries, the share of individuals who've received at least 1 dose of a COVID-19 vaccine, recognizing that for vaccinations like the mRNA vaccines, Pfizer and Moderna, it requires 2 doses to be fully immunized and fully protected. And even then, you should think of that notion of fully immunized to be 10 to 14 days later. Nonetheless, what you can see is a rapid increase in Israel, also here a continuing increase in the United States. And I think we're aware that some of the rates, these 3 million a day levels, have started to go down a little bit. Nonetheless, we're still increasing that share. What I want to then is contrast what has happened in Israel in terms of new confirmed cases per million people, really dropping precipitously in the last month or so in Israel with these high levels of vaccinations. And although there was a bit of an upsurge, it was nothing like that in the late winter or even past summer or spring, reinforcing yet again, just like Ben said, the impact at the rates of vaccinations. Once we're getting above 50%, we're starting to see effects, but ideally we're going to get even higher into this 80% or above. And one of the reasons we should do so is because vaccinating at large scales really is the most safe and ethical way to reduce both our individual and collective risk. And because this is a Georgia Tech Town Hall, I'm going to include isoclines. So for those of you who are willing to bear with me for a moment, what I'm trying to describe here are a combination of ways to increase immunity in a population, which are these shaded values, and these dashed lines are lines of equivalent levels of immunity. And one can get 50% immunity because half the population is infected or half the population is vaccinated or some combination thereof. And because, as I've said before, most of the cases have not been documented, we're often, in some cases, vaccinating individuals who may have been unwittingly infected earlier in the year. So if we start a population with about 30% infected, for context, this is equivalent to something like 500,000 fatalities in a population the size of the United States. If we then emphasize, and this is both a public health as well as individual choice matter at this stage, if we emphasize vaccination, we can get to that 80% level of immunity in a much safer way. We could not do that, and if natural infections are allowed to continue, one can also hit 80% immunity, but really the wrong way, with large-scale infections and all the consequences thereof. So I've put these vaccination programs sort of red, yellow, and green, emphasizing that what we're trying to do on campus, what the state is trying to do, what the country is trying to do, or should be trying to do, is to emphasize going vertical in these plots. In other words, increasing the fraction of the population that is immune to circulating variants, SARS-CoV-2 and the majority of variants that we are aware of we remain protected by these vaccinations. And again, these vaccinations are almost certainly more effective, we think, than is natural infection in the sense of having a broader scope and simply just a safer way to build population immunity. So that's what we're trying to do. We've actually built a dashboard to help compare where states are in this process. And here is an example of this same idea, but now in real time. And this is done with an undergraduate here, Quan Nguyen, and Dr. Stephen Beckett and my team. You can see the United States in terms of 1+ dose, we have about 40% plus of individuals, and this is with a 2-week lag, it's even higher now. When we look at fully vaccinated, it's a little bit less, about 30%, which implies we may be already past the point where half of the adults in the United States have some form of level of immunity, but that still means that the other half does not. And what we're trying to do is increase this, as I said, vertically. You can see the example of Michigan increasing population immunity, but going to the right because there was a surge. Places like Hawaii and Vermont and Washington that have done very well in terms, relatively speaking, in terms of total infections, remain in some ways more vulnerable because there are many more people who have not yet been infected, and they thankfully are doing better with respect to the population infected. Here's Georgia. We've been somewhat laggard in terms of the overall rates, so there's still an opportunity for the next few months to have this number increase, and that's really the context that we're operating in at Georgia Tech, that we're doing better than this average in terms of fraction of individuals vaccinated, and it's key not just to do this one dose, but really go to get that second dose of the Pfizer vaccine, make sure you get the full benefits and protection of immunity. And in doing so, I think it's important to recognize that decisions here at Georgia Tech, there are some things that we can control with respect to the testing and also the size and investment in this vaccination program. Many college campuses have gone farther and have actually mandated vaccination requirements, in some cases just for students, in other cases for faculty, staff, and students as part of their return to campus program for fall 2021. And I just want to explain some of the reasons why such mandates have come into play. For the most part, they build on standard vaccination requirement protocols already in place. For example, we have them in the Board of Regents program, and as you know, students coming to campus, there are already pre-existing vaccination requirements. Most of these vaccination mandates have some language that are contingent upon full FDA approval, which I expect to be in the near future, although that's still somewhat uncertain. Some of them say even in the EUA process that's still going to be mandated, but some have started to include this contingency term, which we expect. This doesn't necessarily include fully online programs, but it does apply to anyone who's going to be part of any in-person on-campus experience. And of course, these programs have to build in exemptions, which are part of the standard vaccination requirement protocols, as Ben mentioned, some true counterindicators. And as need be, these programs also need to vaccinate upon arrival. And just as context, with more than 100 million infections estimated by the CDC and approximately 600,000 fatalities in the US alone, college campuses and leadership have made decisions to protect the health and safety of these dense live-learn communities. We know that outbreaks can happen in college campus-like settings. We've tried very hard through the past year collectively to use testing as a form of mitigation. Vaccines are a weapon in the arsenal we did not have available to us last summer. They are available now. They're safe, they're effective, and available to anyone 16 plus throughout the United States. And I think these are all the reasons that many places have already made this step to go a step further and push towards mandates. At present, a mandate is not present in the BOR USG system, nor at Georgia Tech. Nonetheless, we strongly encourage anyone who has not yet been vaccinated to consider and take advantage of that opportunity throughout the vaccine clinic available at the exhibition hall throughout May, as Dr. Ben Holton already noted. So just some key takeaways, and we'll switch to questions. I think we all know that COVID-19 has had major impacts on health and well-being, both in the US and worldwide. Given these increasing vaccination rates in the United States, there really is reason for some optimism with respect to unfolding of dynamics. We've seen the impacts at the country level of large-scale vaccination programs. We're seeing impacts here on campus already. We're seeing the impacts nationally. But we have to be aware the pandemic is not over, not only because there are still many individuals who remain vulnerable to infection, and in the absence of large-scale vaccination, they will still be as cases circulate. And we're also where we're connected not just to our local community, a national community, but a global community, given the international nature of students, faculty, and staff on this campus. And obviously many regions, whether it's in India or South America, Brazil, Argentina, or Uruguay, just three examples, are facing some of the worst period for cases, hospitalizations, and fatalities thus far. And our thoughts are obviously with those communities, and hopefully vaccinations that are available here can begin to be distributed globally to try and mitigate really this ultimately global pandemic. At Georgia Tech, large-scale testing, mitigation, and vaccination have made an enormous difference. So individual steps you take now to get vaccinated truly are a win-win, protecting you and the community. I just want to reinforce, a vaccine is reserved for you at Georgia Tech. Use the opportunity, get vaccinated in May if you have not already done so. And with that, I want to once again thank all the folks who've been involved in the testing program, the mitigation program, trying to design safe returns to campus, and in particular, thank my colleagues, Professor Greg Gibson, Dr. Ben Holton, JulieAnne Williamson, for their part in this presentation today, and we're all happy and available to take questions. Thank you.
Okay, great presentations, guys. Tanish, I would like to invite you to moderate the Q&A whenever you're ready.
Thank you so much, Dr. Streelman. Good afternoon, fellow Yellow Jackets, and thank you for joining us today once again. We will now be moving on to the Q&A session of the Town Hall. And so I will be directing the questions that all of you have asked to the panelists. And I will begin with the first question. And this is just a general question to any panelist who wants to share their knowledge and opinion on the same. But the question is, will the vaccine be mandatory to come back to Georgia Tech's campus? If not, why?
Dr. Holton, do you want to start on that, and then maybe I'll fill in?
Yeah, I'll start on that. So right now, there is not a plan to make vaccination mandatory for returning to campus in the fall. That's really not a decision that Georgia Tech would make. That is a decision that would be made at the USG level. And in terms of why, I think there are a number of people who have reservations about the vaccine, or at least questions about the vaccine. There is a lot of incorrect information about the vaccines out there, unfortunately, and sometimes people latch on to that, and it leads to kind of misconceptions about the safety of the vaccines, how well they've been tested, how effective they are. I I've been really delighted that the Georgia Tech community has embraced vaccines, that there has not been really a lot of pushback against the vaccine program. And I think that's a reflection of the culture that we've created this year on campus in terms of how we've approached COVID. It has been a very data-driven process. It's been embraced. It's been supported by leadership. It's been led by our experts on campus, and it's been embraced by the campus community. And I am hoping that that will continue as we go into the fall, and that those who will be joining the campus community in the fall will incorporate that same culture, that they will be infected, quote unquote, with that culture themselves, and embrace both our mitigation measures, our testing, and our vaccine push.
Can I jump in as well, if possible? I think one of the nice things about these town halls is that they've been bottom up, reflecting views of faculty. And I'll just, to give some perspective, when we have had meetings over the past year, we haven't always agreed on every fine point. And that's been part of, I think, a productive dialogue that we've had about trying to have honest, open debate about the best ways to approach things, whether it was the mask mandate last year, the extent to which testing should be mandatory or strongly encouraged. How can we make the best out of the situation of testing that we did have? With respect to vaccines, and I'll represent now only my personal view, I think that there's a significant, compelling evidence as to why a path forward for mandating vaccination is prudent. I also agree with Dr. Holton that that decision almost certainly should be applied system-wide, given the nature both of BOR's charter, GT as being part of that university system. But there's good reason, as I tried to explain, why campuses have tried to get ahead here. And I noticed in the question, someone mentioned the experimental nature of the COVID shot. The EUA, the E in EUA does not stand for experimental. It stands for emergency use, because we are in a global health emergency. And the use of vaccinations are being distributed at scale precisely because many years of research prior to this one have led us to the point that they were able to accelerate the process of evaluating for safety in small-scale studies, safety at larger-scale studies, and efficacy at larger-scale studies. And unfortunately, the reason why even the efficacy part of the vaccination trials went faster is because how many cases were circulating. So it was easier to get evidence that the placebo arm was worse than the vaccine arm of these trials. So I do think that that's something that's obviously out there, and you can see in the questions there's disagreement. Nonetheless, one of the most effective ways that we can get ahead of this, frankly, whether or not you agree with me or not on mandates, but I think Dr. Holton and I would agree that the vaccine is really going to be an essential part of our efforts to control spread in the future and really get us back to normal life faster. So I don't know if, and so yeah, I hope you're getting a sense of this town hall of what I think are the constructive, respectful debates that we have even internally, but I think it's important to shed some light of that in light of the kinds of questions that I think we're seeing in the Q&A.
Thank you so much, panelists. Here is another general question. How will new students for summer and fall semesters be messaged about when and how to get vaccinated before they come to campus for classes? If any panelist wants to jump in and give their opinion on this.
Yeah, I'm not aware of what information has been sent incoming students about our testing or vaccination program that's targeted specifically to them. I know that Institute communication has been a major part of our communications to all of campus about the availability of both testing and vaccination. There is a planned communication from Institute Communications about the availability of vaccine during the summer, and it's going to reflect the information that I shared earlier, that we'll continue our vaccine clinic 5 days a week through May, and then we'll be reducing the frequency to once a week for June and July. We will be scaling our vaccination effort up again in August with the arrival of students. I know there's another question in the Q&A session about when students arrive in the fall, particularly international students who may not have had an opportunity to get vaccinated. We know that that's going to be a student population that may come to campus without having had an opportunity to get vaccinated. We will be providing an opportunity for them to get vaccinated when they arrive on campus. Historically, we've always had what we here at Stamps call Welcome Week, which is the week before classes start. We divert many of our resources to the effort to get students, help students meet the immunization requirements that we've traditionally had. So in parallel with that, we will be doing a vaccination clinic for those students who have not had an opportunity to get vaccinated during the summer. We do anticipate that the most significant student group that will need it at that time will be our internet. There has been some recent guidance that's come out regarding people who have gotten a vaccine in another country that is not approved or not available in the U.S. Do they need to be revaccinated once they arrive in the U.S.? And so the current guidance is that if you have received a vaccine that's either FDA authorized or authorized by the World Health Organization, you do not need to get revaccinated once you arrive here in the U.S. If you've been vaccinated with a vaccine that has not been authorized by the World Health Organization, then it is acceptable to get revaccinated with a vaccine that's approved here or authorized here in the U.S. And that's, at least right now, that's the approach that we're going to take in terms of how to address students from other countries who may have been vaccinated with a product that is not available here in the U.S.
Thank you so much, Dr. Holton. Here's another question. It says, why would someone that has COVID need a vaccine? Shouldn't students just be able to show a positive antibody test instead?
So the current thinking is that we don't know how long protection or immunity to COVID after infection lasts. And concern is that it will not last as long as it does with the vaccine. Right now, the current thinking, at least the guidance, is that it lasts for 90 days. There is some data that suggests it may last as long as 60. But the purpose of the vaccine is to confer long-term immunity. Granted, we don't have long-term data on the vaccine as well, since it is new. But we have reason to expect that the immunity from the vaccine will be longer lasting from infection.
Thank you so much.
Maybe I'll just add into that, to add to Dr. Holton's response. The CDC is recommending exactly that same approach with respect to having a vaccination irrespective of prior infection status. And there's another part to that too, and I understand this notion of both having a positive antibody test. Keep in mind, the majority of positive cases were almost certainly undocumented. And even if one has had a prior infection, you can still get a negative serotest because there can be what is called seroreversion, where your antibody tests or antibody titers are below the level of detection. That does not necessarily mean you're immediately susceptible. So we want to keep that in mind. So it's just a little bit hard to use these prior tests as our indicator. And ultimately, what we're trying to advocate is the safer way to build up both your individual and collective immunity, right? Without all the negative risks of having a replicating virus. Right? This is yet another reason that in these controlled studies, seeing all the benefits, especially with severe outcomes, that really was the baseline rationale for approving the Pfizer and Moderna and the J&J vaccine in the first place, is their documented ability to reduce the risk of severe outcomes, which is ultimately the reason why there's been a shutdown and lockdowns, mask interventions, and so on. Is not just because of the mild case, because of the severe cases. So we strongly encourage people to get a vaccination irrespective of their prior infection status.
Thank you so much, panelists. Here is another question. Given that Georgia Tech has survey data, what do we think will be the ultimate vaccination rate for campus as a whole in the fall semester across faculty, student, and staff?
You want to take that one since you talk a little bit about the survey, maybe? At least in part.
Yeah, I mean, I'll put a number on it. I'll say 80% plus or minus 20%. I mean, I think we'll be at least at 60%. I doubt we'll be at 100, but somewhere in the middle. Now, is that enough? It's certainly going to be enough to protect most of those 80%. So the 20% who choose not to get vaccinated are going to continue to be at risk. That 80% will be enough to slow transmission on campus dramatically. So we really just don't expect a large outbreak. But don't forget that we're about protecting staff and faculty as well, who are more at risk of adverse consequences. So we want to keep it as low as possible for the health of absolutely everybody on campus. This is my chance, I guess, to say something. So on the mandates, my class survey found that about 20% of people on campus were not in favor of a mandate, 80% were. So that indicates quite a large proportion of the campus community who are not comfortable with that. And I totally respect that. I think we all do, but so our messaging is just much more that really in the absence of vaccination, there's not much alternative, that we'll be back to the way we were this past 2 semesters. So it's our choice collectively, and I'm very emboldened that people seem to be embracing that choice for the most part. And if it's 70 or 80%, then I think we're in pretty good shape, but not great shape.
Thank you so much. Here's another question. Do you have any estimates as to when booster shots might be available for general public? And do you think Georgia Tech might serve as a site for administering these boosters to student, faculty, and staff?
I don't have any information about if or when booster shots will be needed and available. There's been some preliminary information from Moderna and from Pfizer representatives that a booster shot may be needed, but there hasn't been true scientific consensus on that or a conclusion on that. In terms of whether stamps will or whether Georgia Tech will serve as a site for administration, I don't think we know the answer to that. We've been very successful with our initial vaccination program. I think if we reach a point where booster shots are needed, it's very likely we would be a site for that. There are a lot of issues a lot of questions that would have to be answered before we make a definitive decision about that. But our goal all along has been to protect the health and safety of our campus community. That will not change going forward. If booster shots are deemed to be necessary, I think it's very likely that we would make that investment. That's not a decision that I would make as the director of stamps. It's really going to be something that's made at the executive leadership level. But I think that the odds are pretty good that we would move in that direction. I've been hesitant to think about that, to be honest. I've been trying to just get through the administration of the initial round of vaccines and try to make it to summer. My whole team needs a vacation, so I think we'll be more receptive to thinking about that after we've all had a little break.
That's a good form of vaccine hesitancy, Ben.
And to jump in a little on the if and when, I think it's also important to point out that this question of boosters relates both to, we often think of a booster as more of the same, but it may be different. And that's partly, I think the if part has to do with the effectiveness of vaccines vis-a-vis variants. And just to keep in mind that the reason why we have more and more variants is because of the vulnerability of individuals who get infected and virus replicates, and then there are more variants. So we're hoping that effectiveness of vaccines will actually reduce the need potentially even for boosters down the road. So it remains an if and when kind of question at this stage.
Okay, I'm going to jump in just to say that we are approaching our hour. It's almost 5 p.m. And so I think this has been an excellent town hall with lots of good information, as well as I think some really good questions. So I think the Institute will be following up on many of these questions because they're informational about will testing continue, will vaccinations continue, and so on. This town hall will be posted on the College of Sciences YouTube channel and a few other sources where folks can refer to it. I just want to finish by thanking everyone who attended, as well as all of our experts for this town hall and the 4 that preceded it. I think these have been super valuable for the school and then tremendously valuable resources for the Georgia Tech community. So with that, I'll say thank you again, and I'm going to end the broadcast.